Heart failure is a disease few know about, and fewer still understand. Even though the words heart failure are more likely to show up in common use these days than in times prior, many continue to ask the same question as my patient's wife. What is heart failure? Heart disease, in many ways, is the overlooked affliction of our times. That seems like a curious thing to say for a disease that touches so many, young and old, man or woman, black or white, rich or poor. And even as the number of people dying from heart disease continues to rise, many proclamations of the end of heart attacks have been made, and such pronouncements are having an effect. Funding for research for heart disease and the development of new innovations for heart disease continues to lag behind other diseases such as cancer. Fewer therapies are in development for heart disease today than before. This is driven by many thinking of heart disease as a battle that has already been won, with funding being increasingly diverted to other conditions such as cancer, dementia, and diseases such as amyotrophic lateral sclerosis, ALS. Breast cancer, for example, receives 7 times more research funding than heart disease for every death that it causes. The media is far more likely to play up incremental and unproven advances in other diseases while ignoring proven and life-saving therapies for heart disease. Many people think that when people get heart disease, it is their fault, and increasingly, as treatments get better for heart disease, people acquire it in older age rather than in their younger years. Even some of the leading experts in cardiovascular research are not optimistic about the future of research in heart disease. And despite the amazing reduction in the death rate from heart disease over the past few decades, the last few years have seen that progress effectively plateau, and even some disconcerting reversal occur in the rate of death from heart disease. And yet, the present and future of how we can treat and prevent heart disease have truly never been more awe-inspiring. There is almost no parallel in human progress that mirrors how we have managed to change a heart attack from a death sentence to something that for the most part can be managed safely. Just over the past few years, I have seen technology become commonplace that could easily have been conflated with science fiction. The heart, that muscular organ beating in your chest as you listen, sending pulsations throughout your body, is perhaps the part of the body most associated with life at both ends of human existence. Hearing a heartbeat has become a rite of passage for anyone who becomes pregnant. When my wife got pregnant, it wasn't until our visit to the gynecologist at the 8-week mark that we heard that machine gun-like heartbeat, and the pregnancy was truly confirmed, and we breathed a sigh of relief. On the other end of existence, when someone falls to the ground unconscious, the reflex of anyone with an ounce of knowledge about the human body will be to reach for their wrist and feel for a pulse. If there is a pulse, there is life. If there is no pulse, there is no life. And hopefully someone is straightening out their elbows and locking their fingers as they get ready to perform cardiopulmonary resuscitation. The pumping heart keeps the circulation of the body going. Blood seeping through the vine-like arterioles webbed through the lungs picks up oxygen that we breathe in. These vines then merge to form bigger vessels, which lead into the left side of the heart. The left side of the heart, the most muscular part of the heart, then pushes the blood to every part of the human body, from the kidneys to the intestines to the limbs, and all the way to the tips of the toes and fingers, but most importantly, to every vital nerve cell in the brain. These organs suck out oxygen from the blood like you would that last bit of that Slurpee with a spiral straw. This oxygen-deprived blood is sucked all the way back to the right side of the heart, which then squeezes this oxygen-poor blood into the vine-like arterioles lacing the lungs to fill up on oxygen. The constant circulation of blood is like a divine, life-giving pilgrimage. When blood reaches the lungs, the temple of life, each red blood cell, all 5 million or so of them, squeezes into teeny-tiny alleys, as opposed to the large highways it drove in from. These tiny alleys are called capillaries. It is in these capillaries that each and every red blood cell comes face to face with the invisible source of life.